name is Dr. Katie Eastman, and I've been in the field of mental health since I got out of college in 1982. And my specialty and my passion in mental health is helping people navigate through some of the most difficult life situations that cause intense trauma, grief, and loss. After college, I got a master's in social work, and I did master's in theology work, and then I got a doctorate in psychology, specializing in medicine.
Your journey has been interfacing with young people, and that involved interfacing with a lot of pain. And now you work with all ages and deal with more of a holistic pain as well, and as you always have. But when you work with pain, whether it be physical or total pain, what informs your practice when you think of someone that's going through that pain or has had a lot of chronic pain?
I have always looked at pain from several dimensions. I don't believe that we make our decisions every day in our lives based on one dimension, our physical. We also make it from our spiritual and our emotional. So pain, like everything, impacts all aspects of our health and well-being. So I approach it from that aspect. I always ask people, what gets you up in the morning? What keeps you going? What gives you a sense of hope? What gives you a belief that something can get better? That's their spiritual component. The emotional is, how are your relationships? What's happening? What are you arguing about? Are you irritable? How is this impacting you? Are you depressed? Are you sad? Are you fatigued? In most cases, all of the above. Then I ask them, what can you do? So I always ask pain patients, what are you able to do? I know there's a loss with what you can no longer do, but what are you able? No, you can't walk that 4 miles, but can you walk 1? No, you can't walk 10 feet, but can you stand up? So it's always looking at what they are able to do and drawing from that to give them strength and capacity to try a little bit more. I also am really emphatic about the fact that I don't like it when people say, I had a good day or a bad day. I always say every day is a good day, but you had challenging moments, challenging times. Because I think it's really easy for someone to get up in the morning with chronic pain and say, oops, this is a bad day. And I want to really keep them from doing that.
Wow, that's really profound. So when we think about a perfect model, as there is no perfect model, but what would be more of your idea of the best model for pain control and caring for a person in pain?
Well, I was really lucky to be able to study at MD Anderson Cancer Center and their pain clinic. And I loved it because it was an interdisciplinary model, and it was about the best I've ever seen, because there were psychologists and social workers and physicians and nurses and PT and OT, and everyone worked as a team. And so every patient of the chronic pain clinic was always given a holistic approach. So they didn't leave the hospital going to a vacuum. They left the hospital with a team of support in place.
That's wonderful.
All of their medical, emotional, and spiritual needs were taken into consideration. Case example, someone once had a very chronic pain situation that inflamed, and nobody could figure out why. And it was a physician, actually, who made the comment, I wonder if it's spiritual because we've let out everything out. I mean, what ended up happening is someone had come in and told this person they were going to hell, and they believed it. And so what we did is we did an intervention with a chaplain who came in and said, why would you believe that? And the pain went away. So we cannot think of pain in a vacuum. It is not unidimensional. It is many dimensional.
Talked about pain clinic. You mentioned the pain clinic and your experience of the one at MD Anderson. What do you believe is the importance of psychosocial care in pain management?
It is essential that the support system for every pain patient be considered, because they are the ones that are with them day to day, 24/7, and they are the ones that help influence how they view their pain, how they play the sick role, how empowered they feel. If someone wakes up in pain and they don't want to get out of bed, if their partner says, "Oh, you're just being lazy," well, that's going to make a huge difference in their approach to their pain. Whereas if their partner says, "Well, let's just try one step at a time and I'll help you," that's a big difference. So emotional well-being is largely impacted by the people in our support team. And having them a part of the pain management and the pain treatment is essential.